Hi, this is T.Valenta. We're talking today about cardiovascular structure and function. So the objectives are to describe the anatomic location and function of the following cardiac structures: the pericardial layers, atria, ventricles, semilunar valves, and the atrioventricular valves. Also describe coronary circulation and the areas of heart muscle supplied by the major coronary arteries. Describe the appropriate techniques used in the physical assessment of the cardiovascular system. Differentiate normal from common abnormal findings of a physical assessment of the cardiovascular system, and describe the age-related changes of the cardiovascular system and differences in assessment findings. So key terms that you're responsible for knowing are afterload, arterial blood pressure, cardiac index, cardiac output, cardiac reserve, diastole, diastolic blood pressure, ejection fraction, mean arterial pressure, point of maximal impulse or apical impulse, preload, pulse pressure, systole, and systolic blood pressure. So stroke volume is the amount of blood pushed through the heart with each contraction. Cardiac output is stroke volume times the rate. Preload is the stretch of the ventricle before contraction. So remember Frank Starling's law. Afterload is the resistance that the ventricle has to pump against. This can be caused by increased blood pressure or pressure within the pulmonary bed if the right ventricle has to push harder against that force. And then the heart can alter its cardiac output to adapt to the metabolic needs of the body.
Pump up, pump, 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 pump up, pump, 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 pump up, pump, 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 pumps your blood. The right atrium's where the process begins.
Okay, so when thinking about circulation, think of the heart as two pumps. Right side pumps to the pulmonary bed, and the left side pumps to the body. Take a look at the video.
Then it's back to the heart, through the pulmonary vein, through the atrium and left ventricle. Pump up, pump, 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 pumps your blood. Pump up, pump, 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 pumps your blood. The aortic valves where the blood leaves the heart and it's channeled to the rest of the body. The arteries, arterioles, and capillaries too bring the oxygenated blood to the cells. Tissues in the cells trade off waste and CO2, which is carried through the venules and the veins, through the larger vena cava to the atrium and lungs, and we're back to where we started in the heart. Pump up, pump, 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 pump up, pump, 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 pumps your blood. Pump up, pump, 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 pumps your blood.
About the size of your fist, the human heart is the most important muscle in the body. It can beat more than 100,000 times a day, pumping about 2,000 gallons of blood through a 60,000-mile network of vessels in the body. The human heart is made up of four major chambers: the right atrium, right ventricle, left atrium, and left ventricle. The right side of the heart receives blood that is low in oxygen from veins all over the body. It then pumps the blood through the pulmonary arteries into the lungs, where it will become reoxygenated. The left side of the heart receives this oxygen-rich blood from the lungs. Then it pumps the blood through the aorta back out to the rest of the body through a complex network of arteries, arterioles, and capillaries. While blood is circulating through the body, it delivers oxygen and nutrients to tissue through the capillaries, and at the same time picks up carbon dioxide and other waste material. The veins return the deoxygenated blood to the right atrium, and the cycle begins again. The heart has four valves. Each valve is like a one-way door that keeps the blood in the heart flowing in the same direction. The valves are made up of 2 or 3 small but strong flaps of tissue called leaflets. Leaflets open to allow blood to flow through the valve and close to prevent blood from flowing backward. The opening and closing of the valves is controlled by blood pressure changes within each heart chamber. The tricuspid valve is positioned in the heart's right side, between the right atrium and right ventricle. The pulmonic valve separates the right ventricle from the pulmonary artery. The mitral valve is positioned in the heart's left side, between the left atrium and the left ventricle. And the aortic valve separates the left ventricle from the aorta. As blood circulates through the heart, some of the blood flows into a set of much smaller blood vessels that provide blood directly to the heart. These arteries, called coronary arteries, surround or crown the heart. This separate circulatory system, called coronary circulation, keeps the heart nourished and oxygenated. The two main branches of the aorta that nourish the heart are the right and left main coronary arteries. Coronary artery disease, which occurs when there is a buildup of cholesterol plaque, affects the arteries of this circulatory system and causes a decrease in blood flow to the heart muscle, resulting in possible damage to the heart or a heart attack. The beating of the heart, which is its rhythm, is regulated by electrical impulses generated by your heart muscle. These impulses begin in the sinoatrial node and cause your heart to contract. Sometimes the sinoatrial node is also referred to as your heart's natural pacemaker, since it keeps the heart rate constant and consistent. The impulses then travel to the atrioventricular node, where the signal is checked and then sent through the ventricles, which causes them to contract. Your heart rate can change based upon external conditions such as diet, exercise, stress, or even hormonal factors.
Hi, the lecture will be delivered in two parts to discuss about mediastinal structures as they are shown on a chest X-ray. In a normal chest X-ray, trachea should be central to start with. Deviation of trachea on one side indicates abnormality. Trachea will be deviated towards the affected side in case of atelectasis, pneumonectomy, and pleural fibrosis. It will be deviated away from the affected side in case of tension pneumothorax, large pleural effusions, or large masses. In this case, the trachea is shifted towards the right side. There is a large pleural effusion on the left side. Notice the heart and mediastinum is also pushed towards the right side. Important thing to be noted here is that just before bifurcation, it is always pushed towards the right side to accommodate aortic arch, which is always normal. Rest of the thoracic aorta is visible as a straight line moving towards the middle in order to enter into the abdomen through diaphragm. This is carina, this point, which is also visible here, where trachea divides into right main bronchus and left main bronchus. The angle of carina should normally be less than 90 degrees on an erect view. The right side is always steeper. That is why it is more common for foreign bodies to go into right main bronchus rather than left. Azygos vein lies at right tracheobronchial angle, which transports deoxygenated blood from the posterior wall of thorax and abdomen into the superior vena cava, which is visible here. This is superior vena cava, and it is where the azygos vein drains. This is aortopulmonary window, which will disappear in case of presence of any mass or enlarged lymph nodes. These are branches of right pulmonary artery and left pulmonary artery, which are visible here. So this is main pulmonary artery, left pulmonary artery, and the right pulmonary artery is going to right lung from here. The lecture is prepared for www.academyofprofessionals.com, and these are the references. The sketches and some of the x-rays are copied from www.commons.wikimedia.org and with kind permission from Dr. A.J. Chandrasekhar from this website. Thank you very much. Rest of these structures will be described in next lecture. Thank you very much.
The heart extends from the second to the fifth intercostal space and from the right border of the sternum to the left midclavicular line. Now think of the heart as an upside-down triangle. Inside the body, the heart is rotated so that its right side is anterior and the left side is mostly posterior or behind the right ventricle. The left ventricle forms the apex and the left cardiac border, and the right atrium lies to the right and above the right ventricle and forms the right border. The precordium is the area of the anterior chest overlying the heart and the great vessels. The angle of Louis, or the sternal angle, is the continuation of the second rib. It marks the site of the tracheal bifurcation and the upper border of the atria of the heart, and also T4 vertebra on the back. The mediastinum includes the heart and the great vessels, the trachea, esophagus, thymus, lymph nodes, and other structures and tissues located between the lungs in the middle third of the thoracic cage. This space separates the right and the left pleural cavities. The great vessels are the major arteries and veins connected to the heart. The superior and inferior vena cava return unoxygenated venous blood to the right side of the heart. The pulmonary artery leaves the right ventricle, then bifurcates and carries the venous blood to the lungs. The pulmonary veins return the freshly oxygenated blood to the left side of the heart, and the aorta carries it out to the body. The aorta ascends from the left ventricle, arches back at the level of the sternal angle, and descends behind the heart. The heart is a four-chambered hollow muscular organ, normally the approximate size of a fist. It's divided vertically by the septum, which creates the right and left atria and ventricles. In a healthy heart, the wall thickness of the atrial myocardium is thinner than that of the ventricles. The left ventricle myocardium is 2 to 3 times thicker than the atria. The thickness of the left ventricle is necessary to generate the force needed to pump the blood into the systemic circulation. The four chambers are separated by valves, which are unidirectional and passively open and close in response to pressure gradients in the moving blood. The heart is composed of 3 layers: the thin inner layer called the endocardium, the muscular wall of the heart called the myocardium, and the fibrous outer layer called the epicardium. The pericardium is a fibroserous sac surrounding the heart. There are 2 layers. The visceral layer, or inner layer, is in contact with the epicardium, and the parietal layer, or outermost layer, which is in contact with the mediastinum. Approximately 10 to 30 milliliters of pericardial fluid lubricate the visceral and parietal layers of the heart to prevent friction between surfaces as it contracts.
Physiology during systole. The aortic valve is open. Physiology on diastole. The aortic valve is closed. Physiology during systole. The aortic valve is open. Physiology on diastole. The aortic valve is closed. Physiology during systole. The aortic valve is open. Physiology on diastole. The aortic valve is closed.
There are four valves in the heart. The two atrioventricular valves separate the atria and the ventricles. The right AV valve is the tricuspid, and the left is bicuspid or mitral, so named because it resembles a bishop's mitred cap. The leaflets of the valves are anchored by the chordae tendineae to the papillary muscles embedded in the ventricular floor. The AV valves open during the heart's filling phase, or diastole. During the pumping phase, or systole, the AV valves close to prevent regurgitation of blood. The papillary muscles contract at this time so that the valve leaflets meet and unite to form a perfect seal without turning themselves inside out. The semilunar valves are set between the ventricles and the arteries. Each valve has three cusps that look like half moons. The semilunar valves are the pulmonic valve in the right side of the heart and the aortic valve in the left. They open during systole to allow blood to be ejected from the heart. Note that no valves are present between the vena cava and the right atrium, or between the pulmonary veins and the left atrium. For this reason, abnormally high pressure in the left side of the heart gives a person symptoms of pulmonary congestion, and abnormally high pressure in the right side of the heart shows in the neck veins and the abdomen. The apical impulse, also known as the point of maximum impulse, is a pulsation created as the left ventricle rotates against the chest wall during systole. It's easier to see in children and those with thinner chest walls. It's usually felt as a gentle tap and normally 1 to 2 centimeters in size. It should occupy only one intercostal space at the fourth or fifth intercostal space and be at or medial to the midclavicular line. The duration is typically short, occupying only the first half of systole. Normal variations that may affect the location include rolling the person midway to the left, which displaces the apical impulse further to the left. It may not be palpable in the obese or a patient with thick chest walls. Abnormal findings, meaning larger than 1 to 2 centimeters, displaced, more forceful, or of longer duration, could indicate enlargement of the heart. The duration of the apical impulse is one of the most important characteristics. A sustained impulse is always pathologic and usually indicates a pressure-overloaded left ventricle, as in aortic stenosis or severe and protracted hypertension. An apical impulse diameter of 2 to 2.5 centimeters in a supine patient, or 3 centimeters in a left lateral D-cube position, is always pathologic, usually reflecting ventricular enlargement. The force of the apical impulse that lifts the examiner's finger is always pathologic of an enlarged left ventricle with good systolic function. You may also find a double or even triple apical impulse called the triple ripple. These are beyond the scope of this course, but for more information you can check Hurst's The Heart Manual of Cardiology by Robert A. O'Rourke. In pregnancy, the blood volume increases 30 to 40%. The average plasma volume increases 50% with a single pregnancy and up to 70% with twins. The heart works harder, so the cardiac output increases approximately 40 to 50%. Cardiac output returns to pre-pregnancy levels approximately 2 weeks postpartum. As the uterus enlarges, there is also a slight axis rotation of the heart, and it will lie more horizontally, displacing the apical impulse. During gestation, blood is oxygenated by the placenta. 2/3 of the blood is shunted through a small opening in the atrial septum called the foraminal valley into the left side of the heart, into the aorta. The remaining 1/3 goes through the right side of the heart, through the pulmonary artery, and bypasses the lungs through the ductus arteriosus and into the aorta. Ventricular muscles are equal thickness at birth. At birth, inflation of the lungs changes the circulatory system, so that within 1 hour the foraminal valley closes, and within 14 to 15 hours the ductus arteriosus closes. Now the left ventricle has the greater workload of pumping into the systemic circulation, so that when the baby reaches 1 year of age, the left ventricle's mass increases to reach the adult ratio of 2 to 1, left ventricle to right ventricle. Infants' hearts are more horizontal, and again the apex is found at the fourth intercostal space. Please view the videos on the next 4 slides for abnormal congenital defects.
Transposition of the great arteries is a heart defect where the aorta and pulmonary artery are switched from their normal positions. Instead, blue or low oxygen blood goes right back out to the body instead of to the lungs. Red or oxygenated blood returns from the lungs and goes right back out to the lungs again instead of to the body. A mustard operation corrects this problem by using a synthetic material, creating baffles to direct blue blood to the lungs to pick up oxygen and red blood to the body to supply the tissues. The aortic tissue is abnormal in patients with coarctation, and this in itself may result in re-narrowing of the aorta. Also, suture lines or stitches from previous aortic surgeries may develop scarring, which also can cause recoarctation. Once again, this causes difficulty in pumping and supplying oxygenated blood to the body. Normally, the heart is divided into 4 separate chambers. An atrial septal defect is an opening between the top chambers, or atria. This allows shunting of blood to the right side of the heart. Over time, this extra blood flow results in enlargement of the right heart and pulmonary arteries. Normally, blue or low oxygen blood returns from the body and is pumped out to the lungs. Red or oxygenated blood returns from the lungs and is pumped out to the body. Tetralogy of Fallot is made up of 4 problems that result in not enough blood flow to the lungs. Complete surgical repair consists of removing the pulmonary valve and opening up the narrowed area out to the lungs by using a patch material. Also, the hole between the bottom chambers of the heart is closed. This allows separation of red and blue blood and augments blood flow to the lungs. Unfortunately, removing the valve allows leaking of blood backwards, which over time results in stretching and weakening of the right ventricle.
In older adults, the size may vary. It may decrease with age in general, or it may increase with chronic hypertension and left ventricular hypertrophy. The left ventricle thickens as an adaptation to vascular stiffening. The valves calcify and fibrose, and the rate slows, the stroke volume decreases, and cardiac output during exercise decreases by 30 to 40%. The myocardium also becomes less elastic. From age 20 to 60, the systolic blood pressure tends to increase by 20 millimeters of mercury and by another 20 millimeters of mercury between ages 60 to 80 due to stiffening and calcification. There is a decreased ability of the heart to augment cardiac output with exercise. Ectopic beats are also common, and there is less ability to tolerate tachycardias.